The Spin-off Podcast Network.
Hey Atlanta, say hello to Small Business Help from Apple. That's right, we're here to make starting and running your business simpler. From helping you choose the right devices to setting them up hassle-free, we can help you build your business in no time. Speak to a business expert and get the help you need at no cost whatsoever. At Apple, we're open for your small business. Go to apple.com/small business or visit an Apple store to learn more.
When you need mealtime inspiration, it's worth shopping Kroger for thousands of appetizing ingredients that inspire countless mouth-watering meals. And no matter what tasty choice you make, you'll enjoy our everyday low prices. Plus, extra ways to save, like digital coupons worth over $600 each week and up to $1 off per gallon at the pump with points. So you can get big flavors and big savings. Kroger, fresh for everyone. Fuel restrictions apply.
When the Facts Change is brought to you by the Spin-off Podcast Network in partnership with KiwiBank, the bank for Kiwi looking to get ahead in business and in life. A bank that delivers expertise in banking know-how, smart advice for business owners wanting to invest, grow their business or diversify. A bank that adapts with technology through the lens of its people and customers. It is a bank with heart that is driven by its purpose. Kiwi making Kiwi better off. It's always fun to bump into a relative you had no idea about, but actually are doing something fantastically interesting. Dr. Huhana Hickey, turns out, is a cousin. There's a lot of Hickeys around in this country, and she's doing some really interesting things. She is a disability advocate and lawyer, a member of the Welfare Expert Advisory Group, and she is right up to date with what's happening in the disability services area, the disability cuts that have rippled through the system, and goes on at great length and in fascinating detail about the problems people who are disabled have in Aotearoa in having enough money and getting access to what's necessary just to live. And we talk about many of the problems inside our welfare system, and particularly around funding, the way money is spent, and the way that the current government is cutting costs in a blunt way, and a way that we discuss is in many ways penny wise and pound foolish. That's this week on When the Facts Change with Dr. Huhana Hickey. Well, kia ora, and welcome to When the Facts Change to Dr. Huhana Hickey, a lawyer and disability advocate, and also a member of the Welfare Expert Advisory Group. Welcome to the show.
Thank you. Lovely to be here.
And as we've discovered talking before our interview, we're cousins.
We are. Isn't that fantastic?
There's a lot of Hickeys in
Oh,
Aotearoa.
mate, there's so many.
That's great.
Catholicism like rabbits before TV.
That's right. We're here today to talk about the state of the welfare state because you're going to be speaking at the Pakukore Poverty by Design conference being organised by the Stout Centre at the Victoria University. And I'm particularly interested in what's happening in the Indigenous and disability communities, particularly in the last 6 to 12 months. There's been a lot of cuts, and some people know there's about some things that have happened, but tell us what's going on.
Well, when the ministry was first announced, it was underfunded, it was under-resourced, and it was brand new. So only 2 years old now. And what happened by that underfunding, they then suddenly brought over all the legacy funding accounts, the service delivery. It never had the capacity to build that at that point. They just threw it all in together. And so what's happened is it's failed. Essentially, it needed resources. But then knowing that Minister Simmons had already told her congregants before the election that she was going to get rid of Waikaha, it makes sense that it wasn't going to remain. Although the adapted new version too could work in our favour if we could still remain independent, because it can become a very strong policy advisor to every department, which is what we originally wanted. Although the uniqueness there is that we had a partnership between Māori and the Crown. We also had the first time sign language as a name for it. We had the Pākehā name and we had a Māori name. So we were working on making sure that truth of partnership, as Te Tiriti outlines, was going to be there, but also ensuring tiri or deaf whānau would also feel a part of it because they identify as a linguist group. So it hasn't succeeded, but speaking with Paula last week, they are hopeful to be a strong policy advisory in the end, and I hope they are.
What was the ambition with Whaikaha? What was going to be improved?
Well, we wanted an independent entity to give strategic advice to government departments because they lack that knowledge. And this department would have the skills and the ability to do that and advise government. So that would have been a better outcome for it. But it became hooked up under service delivery. And then all of a sudden the budget started running right out. And of course, we're in the situation now where budgets are cut. I mean, as disabled with physical disabilities, we're not allowed to travel outside of our region with a caregiver and cover their costs at the moment because they've cut our funding. So there's been some arbitrary decisions, and I know exactly who made those decisions. I won't out them, but they made it based on their own impairment knowledge and certainly not on the issues of physically disabled or other disabilities. And that's the sad part.
And so what does it mean on the ground for people who previously had some more freedom and ability to do things? What's the situation now?
People are struggling. People have lost their budgets, they've lost their respite. A lot of parents are really stressing because if you've got a high needs child that's 24/7, you need respite. And that's just a reality. It's human. Going under MSD is scaring a lot of us because they micromanage people. Will they micromanage our budgets? And really, they don't have the capacity or the skills to decide on that. So we're a little nervous about how they're going to do it, but people have already handed back some of their budgets. Some people have because they can't use them because it's been banned, like using respite. If they can't use it, why have the budget?
So what is it with the micromanaging? What are they afraid of?
That we might have 5 minutes extra with our caregiver. We might actually have our lives, living our lives fully. It's about taking away the very one thing that we never had in the first place, which is our freedom. And that's something that's very strong. Most disabled, the majority of people on welfare, over 55%, have a disability. Most of them on job seeker are either mental health, have a chronic illness, cancer or something like that, or as yet have not gone on to SLP or are being redefined off SLP onto job seeker sickness because now suddenly the disability they've had for 30 years is gone.
And just to remind people, for those who don't know, the level of payments for people on disabilities benefits, how does it compare with the costs of living and what sort of poverty do we end up with?
Well, you're dealing with a lot of disabled, like in myself, I have $600 a month need for medication that's unfunded. As Pharmac increasingly unfunds different medications, but I'm also on medicinal cannabis, so I have to sort that out myself legally. But it's very hard. How does one manage to get that if they haven't got the money? The budgets were covering that. Sometimes working income will pay it to some people and not to others. There's inconsistency in funding. So it makes it very hard to manage one's care and one's treatment. Plus, they've cut back on my district nurse the other day said, we no longer cover this, this and this. You've got to buy it yourself. So we have to buy our own bandages, our own dressings, our own care products for our daily cares if we have intensive care needs. Autism can no longer be diagnosed online, which in a way is not a bad thing. Some have self-diagnosed, which is problematic in itself, and some shouldn't be funded under disability. But that's something for autism and for that network to define, because I'm not autistic, so it's not for me to define. We did need, I'm under IF funding, not Enabling Good Lives, so I have a bit more oversight, which I'm comfortable with personally. I like to know I'm safe with my budgets, and I have an accountant and I do my own wages for staff, all of that, but not everyone's capable of that. So they do still need oversight on how to manage employees, how to manage the funding, and that is an option that's there with all of that funding. But but we've got a problem with sustainability. How does one fund something that has no budget for?
So I'm curious about this idea that the government, in its focus to reduce spending right now, to reduce capital spend right now, so that it can, in theory, get itself into a surplus and reduce public debt, is making lots of what I call penny-wise, pound-foolish decisions. They are cutting spending on bandages and medications, and then people get sick or develop infections, which mean they go and spend 5 nights in a hospital at $2,000 a night, or they are, needing all sorts of other care or housing, or end up in the justice system at much higher costs.
Primary health care is cheaper than tertiary level health care. That's hospital specialists, all that. Our primary health care is in crisis. Our GPs can't see us for 10 to 2 weeks. I just had a woman with an 18-month-old that was telling me she had to wait 10 days and her daughter was sick. I asked what the symptoms were, told her to ring Healthline. That baby was in ICU that night. And that's how dangerous it is. If you don't invest in primary health care, you've got people getting into tertiary health care. And when you've got Seymour's policy of productivity being the driver for who gets health care and who doesn't, then disabled, seniors, Māori, other poor people, disparate groups will struggle. Because I did a quote the other day for the health insurance thinking, I'll pay, maybe I can manage that. $5,000 a month is what I was quoted. It's way beyond any of my budgets. And this is the reality. They're trying to privatise. We pride ourselves on a universal health care, but you can't drive it to the ground. It needs investment, and it needs it now.
If I was looking at this through a purely economic lens, a purely financial lens, and I was in Treasury or advising the government on how do you make the government financially sustainable, the one thing I would say to them is, you cut this money here, it will cost you there over the long run. And I can put a discount rate through this just as much as anyone. You save $15 here, by 2045, it will cost you $915 in 2024 dollar terms. That makes no sense. That seems like a no-brainer for any sort of financial or fiscal analysis if you are only thinking about the world in financial terms, let alone making sure that people, everyone has the same rights, the same care, and that we treat everyone like humans. But if you just want to do the whole financial thing, it makes no sense there either. And I can't understand how these decisions are being made by people who are looking at it through a purely financial lens.
They look at it through an American lens. They seem to want to follow and replicate America's financial models, which is a mess in itself. Quite frankly, we should be following models like Finland, Scandinavian models. They're cutting prisons because they put a therapeutic model in. What you spend in primary care level is what you save at tertiary level. So it is far cheaper than, say, $150,000 to $200,000 a year per prisoner to put that person through a therapeutic lens, providing housing, drug support, alcohol support, around all of that, than it is to put them in a lockup and let them waste away a potential human being for 10, 20 years. I mean, we seem to have this mentality of following Milton Friedman's model of economics rather than looking at somewhere like Finland, which is a similar demographic, the happiest country in the world and probably one of the wealthiest, and why they pay a higher tax. And they're not afraid on CGT and all of those. They deal with wealth taxes. Why can we not proportionately pay more if we've got more? I mean, it's almost like the billionaires are trying to drain all the resources and money off everybody so they can control who can eat, who can live, and who can die. The masses of us seem to be letting them do it because we're increasingly influenced by them.
What do you think about this idea that's put forward by the government that it can use data and very targeted spending and investment in certain interventions, particularly with young people and young mums and various parts of the welfare system, rather than doing across the board a livable benefit or let's just find out where you can get the biggest bang for your buck and inject it in a very specific, small way, and then you can justify that spending. What do you think of that social investment approach?
No, well, it won't work. I mean, if you haven't got the resources in the first place, they have this attitude that every person on job seeker is well, is healthy, is capable. They want job seeker sickness, someone going through chemo and cancer, to be available for work 15 hours a week. They want someone who's got a mental health psychotic state, who's on job seeker sickness because they can't get on SLP, to go to work and work 15 hours a week while they're developing a psychosis. I mean, they want sick people to be working. I mean, I work when I can. Hence why I'm on SLP, and I can work less and less now since COVID, because now I have a permanent infection that they've now told my doctor, don't test them for your infections unless they've got a fever or they're going septic. That's not prevention, and that will kill me. So I'm just trying to stay alive for the next 2 years in the hope they sort the health system out. But privatising social investment can only go so far. We're not charity cases these days. 100 years ago, Charles Dickens highlighted the ludicrousy of relying on charities to keep people out of the poorhouse. It doesn't work like that. You know, we could do it, and we can do it humanely, but we don't need philanthropists to make $39 million profits and then not put it back into the community.
So that supported living payment, the SLP, just for those people who don't know, how much is it? And, you know, how does that compare with your costs?
Well, I'm married and I'm in a state house, so I'm very lucky in that way. I can live off what I've got, which is $361 a week. And, you know, I pay a good sizable chunk of rent, but by the time I pay for my medications, for other stuff, it's gone.
So for those people who maybe are living by themselves and they maybe don't have any sort of extra income, and they are...
About 500.
Yeah, about 500, and that is well short of what's needed. I mean, basically that's rent.
Sleep out. Or one bedroom. I mean, my neighbour, he owns a home, he's got a sleep out there and it's dingy, and he charges $450 a week. And it's deemed to be normal.
When the Facts Change is brought to you in partnership with KiwiBank to help you understand the issues affecting the economy. And that's what their team of experts is here to do too. Here's KiwiBank's Chief Economist Jared Kerr with his prediction on what we can expect from the housing market and interest rates for 2024.
We've seen quite a correction in housing across the country. So house prices fell from the lofty levels that we saw in 2021. The Reserve Bank has pushed house prices down by design and by lifting interest rates to very eye-watering levels. I think the housing market has found a bottom, and I think we'll see house prices rising over 2024 and into 25-26. The housing market will be better balanced. We have seen a surge in migrants, which is adding demand to the housing market, and I think we'll see house prices naturally lift on the back of that surge in migration and hopefully an easing in interest rates later on.
Visit kiwibank.co.nz to stay up to date with detailed economic analysis and forecasts from Jared and other KiwiBank experts. They take big issues from both here and overseas and make them relevant to Kiwi businesses.
This episode is brought to you by Amazon. Sometimes the most painful part of getting sick is the getting better part. Waiting on hold for an appointment, sitting in crowded waiting rooms, standing in line at the pharmacy, that's painful. Amazon One Medical and Amazon Pharmacy remove those painful parts of getting better with things like 24/7 virtual visits and prescriptions delivered to your door. Thanks to Amazon Pharmacy and Amazon One Medical, healthcare just got less painful.
So we've just gone through, 5 or 6 years of quite intense focus on our welfare system, and it looks like we're going through it again. We had the Welfare Experts Advisory Group, which you were a member of. We had the Prime Minister as the Minister in charge of reducing child poverty, and as the Prime Minister and the Leader of the Cabinet in charge of the government's finances. And there were a bunch of recommendations that came out of the Welfare Expert Advisory Group, which, came from a group that wasn't just, a bunch of for the want of a better word, lefties. This was a group from across the community and looked at the evidence base. It wasn't just a collection of of edicts and preconceived notions. And they all seem
went
very
in.
sensible. Yeah.
Yeah, well, we went in and talked to them, and we found out why the homeless don't go to work and income. They're terrified. They have trauma. They won't even walk in the door. They can't. They physically can't. That's how much trauma that's caused to them. We had young mothers in a parent group where they were at work and income, and one was talking about wanting to become a police officer, but her father was one of the heads of one of the gangs. So she was denied any opportunity to have her own career or break out of the cycle because they keep her stuck in there. I met with ex-cops who are now investigating officers telling us they troll Facebook, they troll social media, and when they find something, their view is that they're guilty before they can be deemed innocent, which isn't the premise of our court system. So they are looking for someone to be guilty. And I have been there when I've watched the tragedy of whānau that have been left with these huge debts, sometimes because of the state, and they're left to try and deal with it or go to prison. It's not a good option. The difference with the WEAG group is we identified 4 areas that most people on benefits do, and this is mostly disabled and seniors that can't get jobs after a certain age. And those 4 themes were caring, learning, earning, volunteering. So you've got a large number of people that volunteer their time because they're not working. A good number that care for a whānau member that's disabled or elderly. You've got others that are learning, trying to do courses and things to improve themselves. And then you've got others that are earning, but not earning enough. So living in South Auckland have really opened my eyes to how hard our Pacifica Māori communities here, and especially during lockdown, worked for hours and hours and hours, and yet still couldn't rake enough to pay the rent.
So what do we do about this? You've been on an advisory group which gave recommendations, most of which were ignored. We're going to be talking at a conference where, let's design a better system. What would you do?
Implement WEAG. Just look at it. And the way with funding around disability as well is look at the Warren Forster's ACC report, because both of those together would help towards empowering people who can never come off a benefit. Disabled need that backup. They need a universal pension, really. They should be deemed as pensions rather than benefits because of the unique nature, where you could get them into working when they can work, but don't penalise them for it. Enhance and support them through that journey. And by doing that, it's less stigmatising and we become less invisible, but we become more productive within society. And that is supporting each other to do that. It makes sense. It doesn't make sense to create something else when we've got a winning thing there that's still relevant today as it was yesterday.
Thank you very much, Ngāmihi Nui. Dr. Huhana Hickey, a lawyer and disability advocate and a member of that Welfare Expert Advisory Group, WEAG. Thank you so much for being on When the Facts Change. When the Facts Change was brought to you by the Spin-Off Podcast Network, together with KiwiBank. Visit kiwibank.co.nz to find out how KiwiBank are making Kiwi better off.
The Spin-Off Podcast Network.